Anita, Dan, and I picked the automated Ambu bag. Our problem statement is, typical Ambu bags require the use of both hands to deliver breathing support to a patient, disabling the first responder from the ability to perform other tasks in a timely manner.
The word ambu bag comes from the terms ambulance and bagging. It was first created in 1953 by Danish engineers Dr. Holger Hesse and Professor Henning Ruben. Their goal was to design a breathing apparatus to improve the survival chances of patients in emergencies outside the hospital. This became the startup of their company, Ambu.
The Ambu bag is made up of three main parts: a squeezable bag, a one-way valve, and a face mask. How it works is the bag is compressed, which opens a valve and forces air through the mask and into the person's lungs. When the bag is released, the valve closes and the person exhales the air through the exhalation port. During this exhalation process, the bag automatically refills with oxygen. This process recycles until the person is able to breathe more naturally or until hooked up to a mechanical breathing machine.
Compared to adult, pediatric patients have a larger back of the head, softer facial tissues, smaller lungs, faster breathing, and a larger tongue. So rescue workers have to pay special attention to head positioning, use a round face mask with a smaller bag, in addition to an oral airway to hold the tongue of the pediatric patient in place. However, the guidelines are pretty much the same. According to the American College of Emergency Physicians, the guidelines require the right equipment, body positioning, sealing the face mask, adding oxygen, and the right number of breaths for the patients. Ambubag is extremely important because it's not just used in ambulances, but also used in hospitals, intensive care units, emergency rooms, and general care units, and even in homes for patients that are dependent on breathing machines. Some main competitors are Ambu, Massimo, Smith's Medical, and InSurgical. And the average price for these manual ambu bags are $15 to $30.
The purpose of this project is to automate the Ambu bag, allowing the designated first responder to perform other tasks instead of solely operating the manual Ambu bag. The design statement is to design and develop an automated, portable system to deliver controlled breaths to a patient in respiratory distress.
Design considerations. This slide consists of our preliminary outline of how our automated ambu bag is going to be designed, how it's going to look, what dimensions it will have, how much it will weigh, and how it will operate. So I've used a few websites to help me get an idea of these things, and it provided me with a lot of information of what a typical ambu bag looks like and how it works. So I found that the flow rate of oxygen administered to a patient must be between 10 and 15 liters per minute. Anything greater than this can lead to gastric insufflation or barotrauma, which could potentially be fatal to the patient. I also found a few typical specifications. These are the volume, the dimensions, and the weight of the device. And the three categories of these specifications are adults, pediatric, and neonate or children. So the volume for adults of the bag and how much air should be within it is around 1,475 milliliters. For pediatric, it is 635 milliliters. For neonate or children, it is 220 milliliters. Now the dimensions of the device are 295 by 127 millimeters for adults, 234 by 99 millimeters for pediatric, and 165 by 70 millimeters for neonate. And we get to the weight of the device for adults being 350 grams, 230 grams for pediatric, and 112 grams for neonate. Now, our device, our automated ambu bag, is going to be a little heavier because we have to compensate for the parts that will be added to allow for automated operation, and as well as casing or something to hold the whole product itself. And the material which it will be made of might add some weight to the product, so we're looking at something more around double the weight of an adult ambu bag, so like roughly 900 grams or 2 pounds. And once again, this compensates for the extra parts that will be included, such as like gear system to help it operate in a self-sustaining manner, as well as some casing, which we've come up with a few ideas, whether it be hard plastic or a carbon fiber casing, and this is all going to come down to the cost of production. So we're going to keep those things in mind when designing our automated ambi bag. Another thing I found was that automated ambi bags, or sorry, typical ambi bags have two valves, and one of the valves is for monitoring the oxygen flow rate that is administered to the patient. So the valve allows a correct amount, and I found it being 10 to 15 liters per minute, of oxygen to be administered to the patient. And when this rate goes above that 10 to 15 liters per minute, the valve will close and not allow a greater amount of oxygen to pass through the ambi bag. And same as for when a lower rate of oxygen is provided to the patient, this valve will stay open so that the oxygen can flow more freely to the patient. The second valve is for monitoring the patient exhalation and allowing the exhaled air of the patient to be released from the ambi bag itself. We don't want the exhaled air to go back into the inflatable bag. This will diminish the purpose of the bag of delivering pure oxygen and the oxygen the patient needs to be resuscitated. So I also found that when using an ambi bag, the operator, now this is of a typical ambi bag, not our automated ambi bag, the operator must deliver each breath to a patient over a 1 to 2 second period. And now this correlates with the flow rate of oxygen because it will avoid and prevent the case of gastric insufflation and barotrauma, and it allows a steady breathing rate to be administered to the patient so that they can remain healthy while the first responders are operating and performing other tasks that they need to be doing in order to resuscitate the patient. So now to look at our personal design considerations, we want the product to be portable, so it can't be too big where it has to be, lugged by more than one person to the site of the patient, and it's got to be lightweight. So we said earlier that 2 pounds, roughly 900 grams, which is just about double the weight of an adult ambu bag. This weight is considering, once again, the casing of the device as well as the gears or other parts that are going to be inside the automated ambu bag to help it operate on its own. Finally, it needs to be durable, and this relates to the hard plastic casing or carbon fiber casing that we are looking at using, and it will allow that the system within the ambu bag itself, within the casing, will be protected, and any wear and tear that happens to the product itself will be kind of taken away due to this casing. And now, if you consider any wear and tear on these ambu bags, which need to perform perfectly each time, any wear and tear will, lead to error when operating the device, and any error could lead to harmful consequences to the patient. And the point of our product is that it needs to be reliable and it needs to operate in a way which will resuscitate a patient. It also needs to be able to give the first responder the ability to do what he needs to do to help diagnose and operate on this patient without having to multitask and use the ambu bag, because this takes away the ability to do anything effective and beneficial to a patient if he has to worry about operating the ambu bag as well as doing what he needs to do to resuscitate the patient. So our design is going to be based off of a lot of these specifications, and we're still in the process of coming up with what type of system we want to use to make this a self-sustaining product. A few of our ideas have been, a gear system that can be wound up and then released so that it operates and compresses the ambu bag in order to deliver that correct and appropriate oxygen flow rate to the patient while allowing the first responder to operate on the patient at the same time. A lot of these specifications, as I mentioned, are found from a few sites that I've linked to our Google Doc for our team, and we are still working on the overall design that will allow the Ambu bag to function in a self-sustaining manner. On the next slide, you will find a sketch of our preliminary design, and there are still a few kinks we need to work out and figure out how to make this thing work on its own. Thank you.